We have new news out of the state of South Carolina where the first case, official case of that South Africa coronavirus variant has now been picked up and documented in that state, according to state health officials a little bit ago. Obviously, we've been waiting to see the first official documentation of that following the UK variant, but both of these seemingly still covered by both the Pfizer and Moderna vaccines. At least that's what initial studies on both those vaccines have seemed to show. But how problematic could it be if the South African variant now in South Carolina continues to spread? I want to bring on Dr. Renee Dua, HEAL Chief Medical Officer, joins us now for more on that. And Dr. Dua, I mean, this is something that a lot of people may have expected just given what we saw play out so far. But nonetheless, now the official first case in South Carolina. What do you make of that, given what we know about the vaccine's efficacy so far?
Yeah, thanks for having me on the show. Obviously, it's very concerning. And as we all know, the behavior of this virus is to mutate and change. And so at the moment, we are protected with the vaccines that we have available to us. But it's also becoming more and more clear that we will need boosters to protect ourselves as time goes on.
What does that mean from a planning perspective then for you? We've gotten assurances from Pfizer as well as Moderna CEO, who was on earlier this week, saying specifically that, to your point, they believe their vaccines are still effective against these variants, but they are looking into those boosters. As you try to plan out what the distribution process looks like while also responding to the incoming cases, how does all of this complicate things for you?
I think the complication is twofold. So as a physician, I want to help and I need to be given the vaccines to be able to administer these vaccines to my patients. As the owner of a company that delivers house calls, it is very, very challenging to get almost anything done, certainly here in the state of California. There's not been a transparent communication from our government officials of how to apply, how to sign up, how to even get the doses of vaccines. And so, you're stuck wanting to help and not being able to. I think ultimately President Biden has a plan laid out. I think we will see more fluency in the operations of the vaccines being released and administered. I hope California catches up because we are having raging cases here, certainly in Los Angeles. So more to come and hopefully better news soon.
Yeah, as Akiko was talking about, while it seems like both these vaccines still cover these variants, it does seem like the South African variant is the one that was shown to be less effective in defending against. When you look at this, I should note it was 2 cases documented in South Carolina, both from people who had not traveled. Obviously, it would be bad to see in any state, but South Carolina, we should point out, is one of those states that hasn't necessarily seen as high a percentage of citizens there per 100,000 vaccinated so far. So when you see those 2 cases coming from people who hadn't traveled, what does that indicate to you about maybe the spread that had already been occurring without us knowing?
Yeah, and like I said, I think this virus is mutating. So we are hearing about it in South Carolina, and I'm certain we'll hear about more cases in other states. So I think there is more to come on this strain, this variant, but it tells us that we need to stay vigilant about masks, about physical separation, about hand washing. If you do qualify for a vaccine, go get one if you can. Sign up. All of us who are thinking we can relax and that everything is under control, we are not there yet, right? So I think that's the most critical part of what we're learning.
I know we're only just over a week into this new Biden administration, but we have seen, at least publicly, the new president move aggressively on trying to map out a federal plan for vaccine distribution as well as response to the virus itself. How has that shifted the conversation for you internally? And when do you expect to see the impact from these new changes?
So I think at once it's given us a little peace of mind. Those of us who are frontline, those of us who see patients, we have the peace of mind that things are going to get better and things are going to change. But it's also important to note that while there is a federal government, there are also state governments that are managing the operations of the distribution of this vaccine. And we are left at the mercy of our states and their own organization or lack thereof. So I think, we're waiting to hear more. I can't tell you We have changed any of our behavior. For example, at HEAL, we are still contacting government officials on a daily basis to try to help. We are still hearing about a lot of confusion. I have colleagues and friends who cannot get their second dose. Some have not gotten their first dose. This is really concerning if we are expected to keep taking care of patients and, more importantly, keep them out of the hospital. So, we're waiting patiently. We're standing by.
All right. Well, we wish you the best of luck. Hope to be able to check in with you again as you continue to respond in this pandemic. Dr. Renee Dua, HEAL Chief Medical Officer, thanks so much for joining us today.
Thanks so much for having me. Thanks.